we have a group of idiopathic headache disorders, which are called idiopathic. That means there is no obvious reason for it. And they are miscellaneous. This means these headache disorders do not belong to migraine, to tension type headache, or to cluster headache. They are a group of very different headache disorders, but they are all idiopathic, so no symptomatic cause for this headache. These disorders are so rare that we do not have clinical trials. So this means we do not have any good clinical guidelines. This means that we are relying on serious case reports and on our experience, on expert experience in treating headache disorders. They have one in common that's very interesting. There's one single drug that works in most of these headache disorders, and this is indomethacin. So a simple analgesics up to 200 milligram per day can be tried. Otherwise, every single of these idiopathic headache disorders have their own treatment recommendation. I think we have two unmet major needs for these headache disorders. One is to recognize these headache disorders and to distribute the criteria for it so that everybody, at least every neurologist, can diagnose these headache disorders. The second major need is that we need clinical trials. And these headache disorders are sometimes so rare that you cannot do a clinical trial in 2 or 3 centers. You need a global network of headache centers to do these trials. And the International Headache Society is working on this. I hope that in some years we have a network to do trials on these headache disorders. We have medications for these headache disorders, in particular indomethacin, but this is not always helpful and not sufficient for all patients. And then we can combine it with intervention treatments. Nowadays, we most often use the interventional treatment by peripheral nerve stimulation. This means we try to stimulate the occipital nerve, the supraorbital nerve, sometimes the vagal nerve, so different nerves, cranial nerves. And in the combination of a drug treatment and this stimulation, patients can be treated. We have now drug treatment, we have interventional treatment, but this is not sufficient for all patients. And very exciting is that we now have new classes of headache drugs, which probably will also work in these miscellaneous idiopathic headache disorders. Just let me give you one example. We have the CGRP antibodies, which very helpfully work in migraine. They are really a new treatment for very severely handicapped migraine patients. And we are now starting first investigations, trials, whether these CGRP antibodies do also work in other idiopathic headache disorders. And it might be that some of the group 4 of these miscellaneous idiopathic headache disorders can also be treated by CGRP antibodies, and that would be helpful for the severe affected patients.